measuring and monitoring framework was developed by Charles Vincent, who's an English patient safety expert with colleagues, and was developed as a way to help people rethink the ways in which they're understanding safety in their own clinical environment.
It just is a really refreshing way to be looking at past harm, what's happening currently, and predicting what's happening in the future.
The measuring and monitoring framework is a really different way of thinking about safety for us. It's more than just thinking about past harm, but it's including the other dimensions of reliability, sensitivity to operations, anticipation and preparedness, and integration and learning, and using all of those key dimensions to think about anything to do with safety or quality improvement.
The framework looks at 5 domains. It looks at past harm, it looks at sensitivity to operations, anticipation and preparedness, reliability, and then integration and learning. So it really asks questions around, has care been safe in the past? Is care safe? Is care safe in the future? What are the systems that we have in place to look at reliability? And have we been able to integrate the information that we've taken, and are we learning from it?
Once you learn how to use a tool, this tool, it's a very powerful tool. It can be infused into everything, from the smallest project to a very large endeavor.
The real power is in that cultural shift, that lens of ownership as well of everyone. So right on a unit to the board level.
For the board, we were fortunate in that we were able to bring some of the learnings back, not just from my interaction, but when we had at our board retreat, we had Dr. Ross Baker, Virginia, come out and be able to speak to the board, talk a bit about the framework.
The participants are just on fire. That's how I would describe them. They are so excited about their work. They want to be sure that it continues. They've had amazing learnings through this.
I think what stands out is the culture change that has happened within the unit in the Family Birthing Center. So, I think we went from a culture of not really asking too many questions about how we can prevent some safety issues from occurring, but rather just focused on dealing with them after it's happened.
We were able to engage patients. We found a couple of ways to do that. So first was initially trying to engage a patient and family advisor, which was challenging initially because we didn't really know what we were doing and how we were using it. Once we figured out our safety huddle framework, we were then able to engage a patient and family advisor to participate in our huddles regularly.
Engaging patients was more of a challenge. I think that that's still a work in progress for our group.
I had a practice of announcing the safety huddle in the mornings to the staff, so while they were busy in their rooms, inadvertently some patients actually ended up showing up at our huddle and presenting a couple of concerns and issues. So we do have a plan. We think this is very powerful to bring patients into the discussion.
We managed to engage patients during the implementation phase of the framework by asking them very direct questions about their safety.
I think our team engaged patients at several different levels. We also engaged 2 patients, actually a patient and another patient and her spouse. They came in, they told us their story. That was part of the mapping experience, and really those were the 2 true North stories that guided our work. One of the patients is First Nations and Métis man, and I think that broadened our perspective in terms of not just being safe in the hospital, but also even the community perspective when you live very remote and you don't have the support system that we have here.
I think it's changed the nature of conversations that healthcare teams have about safety. It's made them more mindful, more forward-thinking. A lot of healthcare organisations before the framework were very entrenched in learning from past harm and did very little in terms of moment by moment, what's happening now, what could happen next.
The use of this framework has been very helpful in changing the culture around safety at our institution. We've been having some difficulty in terms of measuring the change. However, anecdotally, our patients and staff feel a lot safer using this framework and being able to discuss safety in a more proactive way.
I often talked about there's that locker room chat that you might finish your shift and say, oh, the bladder scanner isn't working. Whereas what's happening now is the bladder scanner isn't working. What can we do about it today? How can we get it addressed today? And I think what happens then is it's going to mitigate some of those risks around patient safety.
The key way that we did that was just engaging people in dialogue. That was the main thing. So at the base level, we did some trials of incorporating the language into the safety briefing. We've also started to bring that into the communication center to have those safety briefings at the start of their shift.
The framework is a great way to broaden your way of looking at safety, and it's been challenging in understanding the complex and trying to do that knowledge translation to the unit level. But it has been a good way to start conversation on the units with safety.
Staff across our organization, we were able to engage in a number of ways. So we provided a number of presentations at all levels of the organization, so board, senior level, external to the organization at our LIN, and certainly to frontline staff.
As a physician working with this framework, I've had limited exposure to safety frameworks, training or projects in the past. So I've been excited to work and go from a limited understanding to a more significant understanding of what a safety project could be.
We managed to engage staff and physicians into the buy-in of the framework and using it in our safety huddles. So in our safety huddles, we were able to engage staff by having them bring up their own concerns that they see within the unit.
I think our biggest accomplishment that we're most proud of is the culture shift. So even though not all the staff are aware of the framework, we've opened up the conversation on the units with physicians and staff around safety.
We're having conversations about safety with our staff and our patients on an almost daily basis. So I think that's a significant change. And the nature of our conversations have shifted to be more solution focused and less top down and less critical in nature.
I would say that we've gone from a 26% no-show rate to a 0% no-show rate, meaning that 100% of your patients have showed for our procedures, and that is in large part due to us engaging the patients and making them wanting them to engage into their healthcare.
Big challenge now is to ask the question, how do we spread and scale this up in a way that many more units can be involved in this? And we need to consider that question very closely because I think it's an important one.
I would hope in the future that this fire continues to burn and that we are able to spread this throughout healthcare as truly a framework that people can grab hold of, that can help them and in their organizations learn about what's happened in the past, but most importantly, prevent it from happening in the future.
I'm really proud of the work that we've done to bring the framework to Canada, to learn from what's happened in England and Scotland, but then to really adjust it and put it into a Canadian environment. I think we have fewer resources in our organizations to provide quality and safety expertise, and so this framework was a little more challenging, I think, than it has been in other environments. But what we've seen is that staff are really engaged by this idea that they can have an active role in promoting and maintaining safety.
Are we safe?